Good day, sir. I'm insertcathMale2, your nursing aide for today, and today I'm going to perform inserting a straight or unduling catheter to a patient. The purposes of this procedure is to relieve discomfort due to bladder distension or to provide gradual decompression of a distended bladder, to assess amount of this residual urine if the bladder empties incompletely, to obtain a sterile urine specimen, to empty bladder completely prior to surgery, to facilitate accurate measurement of urinary output for critically ill client whose output needs to be monitored hourly, to provide intermittent or continuous bladder drainage or irrigation, to prevent urine from contaminating an incision after perineal surgery, and to manage incontinence when other measures have failed. Then for assessment, first we are going to assess client status. Then when client last voided, the level of awareness or developmental stage, the mobility and physical limitations, bladder distension, any pathological conditions, and allergies, sex and age. Then review client's medical record including physician's order. For planning, gather all materials needed, bring to bedside to save time and effort, and explain the procedure to the client, what we are going to do, why it is necessary, and how he can cooperate. Then provide privacy. Next, for implementation, wash hands. Afterwards, facing the client, stand on the left side of the bed if right-handed. Then if you are right side if you are left-handed. Then clear bedside table and arrange equipments and materials. Afterwards, place side rail on at the opposite side of the bed. Then close the cubicle or room curtain, then to provide privacy. Then next, place the waterproof pad under the client. Next, position client, assist to supine position, slightly abducted the thighs. Then drape the upper trunk with bath blanket and the lower extremities with bed sheets. Only expose the genitalia. Next, if inserting indwelling catheter, open package containing the draining system. Place drainage bag over edge of the bottom of the bed. And then bring drainage tube between side rail and mattress. Next, open catheterization kit according to directions using aseptic technique, and place waste receptacle within reach. Afterwards, don gloves. Next, organize supplies on sterile field. Open sterile package containing catheter. Pour sterile package of antiseptic solution in a correct compartment containing sterile cotton balls. Then, lubricate tip of catheter. Then remove specimen container. Afterwards, the lid should be loosely placed on top and with pre-filled syringe from collection compartment of 3 and set them aside on the sterile field. Next, we are going to check if the catheter is intact. So we are going to check it. So by inserting a syringe with sterile solution, so we are going to check it. Here. So it was intact. So after testing, we are going to aspirate it to proceed. The next, we're going to apply sterile drip to the client just in the over just over the tights of the clients below the penis. And afterwards, we're going to place sterile tray contents on sterile drape between tights. Next, determine that catheter tip is properly lubricated and the male should be 12.5 to 7.5 centimeter, which is 5 to 7 inches. Then cleanse urethral meatus. If patient is not circumcised, we're going to retract the foreskin with non-dominant hand. Then grasp penis at shaft just below glans. Retract urethral meatus between thumb and forefinger. We are going to maintain this way or this position throughout the procedure. With a dominant hand, pick up cotton balls and clean penis. Move in circular motion from urethral meatus down to glans. Then we're going to do it 2 times using clean cotton balls each time. Then pick up catheter with gloved hand 7.5 to 10 centimeter, which is 3 to 4 inches from catheter tip, and hold end of the catheter loosely coiled in the palm. If dominant hand, may grasp catheter with forceps, but it's optional. So we are going to place the distal end of catheter into the urine tree receptacle. Then next, insert the catheter. So we're going to lift up penis to position perpendicular to client's body and apply light retraction. And next, ask patient to near void. As if he was going to void, and slowly insert the catheter through meatus. Advanced catheter 17.5 to 22.5 centimeter, which is 7 to 9 inches in adult, and 5 to 7.5 centimeter, 2 to 3 inches in young child. Until urine flows out the catheter's end. When urine appears, advance catheter another 5 cm, which is 2 inches. Do not force against resistance, because it may harm the client and cause bleeding. Then afterwards, lower penis and hold catheter securely in non-dominant hand. Place end of catheter in urine tree receptacle. Then after next, collect urine specimen as needed. So fill the cup to desired level 20 to 30 ml by holding end of catheter in dominant hand over the cup. With dominant hand, pinch catheter to stop if needed. After that, pinch and release catheter to allow. Then if remaining urine in bladder, urine into collection tray. Then cover specimen cup and set aside for labeling. Next, allow bladder to empty fully about 750 to 1000 ml unless institution policy restricted the maximal. Then, for a straight single-use catheter, pinch catheter and remove slowly but smoothly when urine cease flow. While for indwelling catheter, inflate balloon of indwelling catheter. So we're going to inflate the balloon. So while holding catheter with thumb and little finger of non-dominant hand at hiatus, take end of catheter and place it between first two fingers of non-dominant hand with free dominant hand. Attach the syringe. We're going to slowly insert the syringe. Then inject the solution into the port. At the end of the catheter. Then if patient complains of sudden pain while injecting it, we are going to aspirate back solution and advance catheter further. Then after inflating balloon fully, release catheter with non-dominant hand and pull gently to feel resistance. Then attach end of catheter to collecting tube of drainage system. Next, place the collection bag lower than the bladder. Lower. Then we're going to tape the tubing on top of the tight of the client. Or lower abdomen. Allows slack in catheter, so movement of tight does not create tension on catheter. Then be sure there are no obstruction or kinks in tubing. Place excess coil of tubing in bed and fasten it to a bottom sheet with clip or drainage set or with rubber band or safety pin. Afterwards, remove gloves and dispose equipments, drapes, and urine in proper receptacle. Then we are going to assist patient comfortable position, wash dry perineal area as needed. Then afterwards, instruct the client on ways to lie in bed with catheter, side lying facing the drainage system with catheter and tubing draped over tight, side lying facing away from the system, catheter and tubing extended between legs, and be caution the client against pulling on catheter because it will hurt, and put on clean gloves and obtain a specimen. And after that, obtain urine specimen immediately if needed from drainage bag. The next, label it and promptly send to laboratory or refrigerate it. Next, remove gloves and additional PPE if used, then perform hand hygiene. For evaluation, palpate bladder, and as if client remains uncomfortable, then determine that there is no urine leaking from catheter or tubing connections. Then afterwards, a record of procedure, characteristics, amount of urine, and drainage bag. If what is the level of the urine in this bag contain, that we are going to record it, and the characteristic of the urine. Example, 100 ml. And that's all. Thank you.